We hear a lot of terms, holistic, complementary, alternative medicine, integrative, and now integral. So what does all this mean, and how are they all the same? What's the difference?
Well, yes, a lot of people use these terms interchangeably. However, it's not the most accurate way to do so. If we go back about 100 years ago, there was a very important report that was filed in the United States called the Flexner Commission Report. And it was really sort of the background for, for establishing a lot of the structure of the medical training establishment itself and institutions in the United States. Before that, there was just a scattering of lots of different approaches to teaching and training and different healing systems in the United States. What the Flexner Commission did was it just sort of gathered all of that information up and then made recommendations. And those recommendations established what we would call the primacy of the allopathic or Western medicine system along the lines of what we tend to talk about as established, prevailing established medicine. In the United States, it formulated and then sort of solidified the training program of the residencies, the postdoctoral residencies, which are actually forms of indentured servitude, basically, where a doctor, after all of the years of training to become graduated and as a doctor of medicine, now goes into several additional years of working in excess of 100 hours a week, generally, for a very small salary, subsistence level of living for several more years. That is allopathic medicine, and as we say, that's the prevailing standard of medicine in most of the world today, and particularly in what we would call the Western world. Now, this resulted in most of the other types of healing systems: naturopathic, homeopathic, chiropractic, herbal healing, botanicals, energy medicine, many of the different combined integrative or so approaches to healing to be really pushed into the background. This lasted about 50 years or thereabouts. Then came in the 60s of the United States, there was this widespread movement of freedom of expression and exploration of different lifestyles. There was the peace movement, there was the anti-war movement, there was the environmental movement, there were the civil rights movements. So there was a lot of threat, so to speak, or protest about the established order of things. In healthcare and medicine, that meant that the use of different approaches in addition to what was being put forth as standard medicine was coming more and more into vogue. At that time, the term holistic was more or less what was used. Holistic, again, not having a whole lot of consistency to it, mostly meant using whatever you want to sort of take care of whatever was of your concern. Yet what was of people's concerns at that time was mind, body, spirit, lifestyle, environment, all of these things. And so a holistic approach, more loosely applied, meant any sorts of opportunities to address those aspects of a person's life using whatever approaches may be out there. Later on, as we go into this 70s or so and early 80s in the United States, the Western medical establishment, so to speak, came to understand that there was a rising interest amongst the population in using different approaches. This created a backlash, quite a lot of what we might call the authoritative superstructure having a backlash. And in essence, a lot of doctors and the medical establishment in general began to polarize things. So people would essentially have to make choices that either, I was going to do what my doctor told me to do, or I was going to do something that was alternative. And so things outside of allopathic Western medicine were then considered alternative. Alternative when we're talking about the political authoritarian structure of medicine, put people in an either-or kind of position. Yet that term alternative also applied to many other aspects of life. So we talk about alternative lifestyles, alternative orientations. Over time, however, that people came to realize that it's not a particularly healthy way to be in terms of alternativism, one versus another. And so what came into vogue more and more as people began to say, I'm not having to accept, I will not accept having to choose only Western medicine or only something else. So what began to happen was more and more public pressure was put on the medical establishment and on the local doctors for people to have some respect and some honor given to other approaches that they may have within their culture, within their family, and that they have heard about from sharing. Thus came the emergence of the term complementary. Complementary generally meant that you can take some of your grandmama's herbal tea remedy or some of those essences from flowers or some energy healing approaches, whatever, and use that in complement to the primary medicine, which was still allopathic Western medicine. And thank you.
Thank you.
The decision about that and the permission was was being granted by the doctor, the physician. So complementary was still something that was supplementary to allopathic medicine, still primarily under the control and the permission of the Western allopathic physician corps. Next came then, later as we started to see that a rising popularity of these types of approaches began to take place also in the marketplace. Multi-billion-dollar industries are springing up about supplements and about other ways of healing. And so complementary then began to evolve into what we call integrative. Integrative as an approach then really meant that at the core, for the most part, there is the Western allopathic physician directing you to see an acupuncturist or to an herbalist or a natural nutritionist or a chiropractor, an osteopath, or someone else from another healing tradition. Again, still primarily coordinated and centered around Western allopathic medicine. And that type of integration could be useful in many ways and could be quite helpful for people. Yet still most of the models that we have that are called integrative have the Western medicine still at the core of things and still facilitating and coordinating. When we look at integral is a much more advanced concept and construct over what is integrative. And in the integral model, what we really see is that instead of Western medicine being at the core of things and sort of dishing out and coordinating this web, interconnected web of still separate disciplines, integral is a construct wherein all of the healing approaches are relatively on par with one another. All of the healing approaches and the practitioners from those different traditions will themselves be able to converse and interchange and contribute freely and more or less equally to the overall assessment of what is necessary for the patient or client involved. The other aspects of integral are that it is important for one from any one perspective to have a knowledge, a working knowledge and an openness to all of the other perspectives, all of the other disciplines. And this happens in this conjoined way. The other aspect of integral, therefore, is that there is a knowing, there's a knowledge that comes, which is the overriding knowledge, which is the integral approach, which is the additional layer in terms of how to think about integrality, how to think about utilizing different approaches from different traditions in the course of treating patients and treating the wholeness of the person, spirit, mind, body, emotions, energy, their consciousness, their relationships, the social environment, and of course the procession of time in monitoring their condition and the healing. Thank you.
Thank you.